Have you ever watched your dog slow down and wondered, are they getting older or are they in pain? Because here's the thing, most of us can't tell the difference. And by the time we can, something has already been going on for a while. If you've had that moment, you are not alone. And that is exactly what we are diving into on today's episode of Tails and Tones. But before we get into that, I just want to share something with you guys. Over the last year, I've been very deep in research and well over 100 conversations with dog parents, hours of vets and specialists, and a lot of late nights, all trying to solve one problem. And I kept coming back to it: the way we feed our dogs. So we spend so much time thinking about what goes in the bowl, but also no one talks about how the dog actually eats, their posture, the strain on their neck, and the joints at every single meal. The fact that floor level feeding done twice a day, every day, adds up, especially for dogs already dealing with joint issues, arthritis, or just the wear of getting older. So we've built the Tails and Tones elevated food and water bowl. It's called LV. And it's designed not just to look beautiful in your home, but to actually support your dog's body while they eat. It's been a year in the making and it's almost here. If you want to be first in line when it launched, the waitlist is now open. Head on over to the link in our bio or go to show notes as well. We would love for you to be there. So, hi there and welcome to Tails and Tones. I'm your host, Mariska Nell, also known as Piper's mom. We are joined today by the amazing Dr. Ellie, a ECVS Board-Certified small animal orthopedic surgeon, which is based here in Dubai. Please give a awesome welcome to today's guest, Dr. Ellie Lederer.
But thank you for having me. It's great to be invited along.
Oh, we are so excited to actually learn more from you today. For some of our listeners that might be new to your work, could you introduce yourself?
Of course. So thanks so much for having me along. My name's Dr. Ellie. I'm a board-certified orthopedic surgeon working at Umm Suqeim Veterinary Centre, and I've recently set up a referral orthopedic service there for dogs and cats.
Oh, that is so cool. And before we get into some serious ortho talk, there is something we need to clear the air for and tell our listeners about. And that is that you have actually competed on the BBC Gladiators and you play the bagpipes. And I would like to know, which one of those have you found most useful in your operating theatre?
Oh, that is a fantastic question. Well, to play the bagpipes, you do need quite a lot of coordination. So that's useful when it comes to surgery for sure. Fine motor control and coordination. It's quite exhausting as well, and surgery can be exhausting at times. So playing the bagpipes has helped with that. BBC Gladiators was an incredible experience. What happens, for those that don't know, it's a game show in the UK, and you go up against yourself and one other contender, go up against these gladiators who are professional athletes at a variety of different physical contests. In the operating theatre, as an orthopedic surgeon, it is quite important to be strong. However, now as technology improves, I think that is less important, which is a really important fact because it means that orthopedics is for everyone. Whereas historically, orthopedics had a stereotype where it was only for really big, strong men. Whereas now, with more technology, orthopedics is for anyone, whether you're a small, frail man or a big, strong woman or whatever you are, you can be a veterinary orthopedic surgeon. So I would say they're equally important.
I love that. That is so cool. So we need to get more orthopedic surgeons into playing bagpipes and being gladiators, I feel.
Absolutely. Absolutely.
And you are also a ECVS board-certified specialist. Can you break down what does that actually mean for someone who's never heard that title before?
Of course. That means that you've undergone specific training in your area, in this case, surgery. So, to have a board certification, you have to have specifically undergone a 1 year internship where you're learning from a variety of different specialist surgeons in a multidiscipline practice. And then after that, you do 3 to 4 years learning exclusively your craft, in my case, um, veterinary surgery and small animals, from specialist surgeons. So you focus just in that area for that period of time. You also have to publish research, and you are heavily involved in reading about the latest research and learning about the latest research. At the end of your residency, it's called, you then sit a board certifying exam, which is a hard exam meant to really test the candidates to make sure that those that come out the other side with the board certification are really well balanced, knowledgeable, competent surgeons. They also make sure that we do, during our training, some extra training in things like diagnostic imaging, training in things like pathology, parts that are really important for surgery, but are commonly not focused on during veterinary school. It stands apart from doing a certificate, which is something I've also done, but that's the sort of first level of surgical training that a vet in practice can do. So if you wanted to do some more training as a vet in practice, you might often do a certificate, which is a part-time qualification where you can do online learning and then sit an exam at the end. So it's completely different to doing a residency where you're spending years of your life just focusing
Wow.
on that specific area, learning from people that are already really skilled in that area.
Yeah, so that definitely means like next time you guys are looking for a vet, make sure that they do have some credentials.
Yeah, I
And
think yeah, a
yeah,
big thing here is that often people will call themselves specialists, but they aren't a true board certified specialist. And in the UK, actually, we've got rules about what terminology vets are allowed to use to describe their skills. So you're only allowed to use the word specialist in the UK if you are a board certified specialist and recognised by the body of vets in the UK. Whereas that's something that doesn't exist in the UAE. So people will say that they're a
yeah.
specialist when they may have done a few days of training in that area.
That's so interesting. And orthopedics, what kind of drew you to that?
I've always been really interested in putting things back together. And so orthopedics involves a lot of putting things back together. If patients are unlucky enough to have a fracture, then we're using often metal implants to put their legs back together so they can heal. I'm also really interested in athletic performance. So, and also pets being pain free. And so
Yeah.
orthopedics was a natural direction to go in. You know, if we think about surgeries like joint replacement surgeries, we can give pets a completely new lease of life by taking away their pain using orthopedic implants. And I've just found that so interesting from a young age.
Think that's so important because that is one of the almost like metrics that I have, for our dog Piper, that, I want her to be pain free and to make sure that, we can always know as well when she has any pain or not have any pain. So I quite like that you've mentioned that because, for many people that might not even be like something that they think about because you think, oh, your dog gets happy, it's not giving any signals or anything. So it's definitely something, we can look out for. And is there any signs or anything while we're on that, like what are typically things that we can look out for to know if our dog has any like pain or any joint, discomfort? Because for you, they might walk in and you're like, oh, I can see this, 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 and this. But for us, that's kind of living with them daily. And, it might be something that has deteriorated over months. And it's that slow deterioration that we don't really notice day to day. But someone that haven't seen the dog in ages, they immediately spot it. Like, what can we look out for?
That's a really good question. I'm really happy that you brought up pain in pets because it's something that's really under recognized, not because their owners don't love them deeply, but just because cats and dogs are sort of made to hide their pain. They're not like us. That humans will moan and groan and complain until the end of time about some small problem, whereas dogs and cats are incredible with what they will tolerate and just continue to try and live their life. One of the most common things that I will hear owners say is, oh, they're limping, but they're not in pain. Now, that's just, I'd say, 99% of the time not true. Now, what do I mean by that? Well, dogs limp because they're in pain. Cats limp because they're in pain or something is uncomfortable. The 1% of times that that's not the case is where you have something we call a functional lameness. So where one leg's shorter than the other, then you can see an asymmetry in the gait. It can look like a limp and it can be pain-free, but the vast majority of the time, there is an underlying reason for a limp. So
Yeah.
common signs of pain in dogs, whether it's pain from a joint or pain from somewhere else, would be a change in behavior. So if you have an extremely outgoing dog or cat, and then they're constantly wanting a dog that wants to be with you, and then suddenly they become very aloof, that could be a sign of pain. Or vice versa, you have a cat or a dog who tends to like to spend some time away from you, and then suddenly you can't get them out your shadow, then that could be an indicator that something is up. The most common one with orthopedic disease is limping, lameness, or an asymmetry in the gait. But then things like stiffness rising from rest, difficulty doing things that they would normally do without hesitation. For example, my dogs, there are no rules in my house. My dogs are on the beds. My dogs are on the sofas. It's their sofa, not mine.
Yeah.
So if your dog suddenly is hesitating to jump on the sofa, there's probably a reason, otherwise they would do it.
Yeah.
And so these are common things. I could go on a bit, and I hope that's okay, just to explain a few more
Yeah.
things as well.
Yeah.
So other things that can be symptoms of joint pain are pets that are suddenly starting to lick over joints or focus on it's not necessarily the joint that they're licking. They'll often lick their wrist because it's the closest to them, but that could be a
Oh.
sign of discomfort somewhere in their body as well. And willingness to exercise. Suddenly, your dog or cat is no longer willing to do the activity that they were doing before. So, for example, with the dog, they might be going out on their walks, but then maybe they're lying down when they're going out on their walks, they're seeming reluctant. However, saying that, a lot of dogs, because they just want to live their life and they want to get on with things, they could have a broken leg and they would still be trying to go out on their walks because they want
Wow.
to please you. So
Yeah. Oh.
it can be difficult for owners to pick up pain and discomfort. And that's why, if you're worried about your pet, getting a vet to assess them can be really helpful.
Yeah, because that's a thing that I've actually noticed with Piper's behavior changing towards other dogs. Because she's a very sociable dog. She
Yeah.
loves playing. She loves going to daycare. But then all of a sudden, Piper is being very snappy with dogs if they
Oh, yeah,
get too
that's really
close to
common.
her, and I thought it was a behavior issue. And then, when we kind of got to this, the bottom of everything, her having to go to physio and getting acupuncture, we realized that she was in so much pain. And trying to solve that issue has been, a challenge. But now at least I know that if there are days that she's a little bit more playful, maybe she's not in that much pain, I kind of have her guide, the whole session because she always wants to go and play with the dogs. Like she
Yeah.
runs to our neighbor's front door and wants to play with the dogs. And then, the moment she starts, it's like, oh, I'm getting snappy at the little ones,
Yeah.
and she sometimes wants to sit on the one, and I'm like, oh my gosh, she's so much bigger than this dog, like gentle. So it's these subtle things that you can
Yeah.
kind of pick up on,
Yeah.
and yeah, it's maybe not always a behavior issue. It is actually a pain issue.
Yeah, and that's a really common one. One of the types of referral I see very commonly is for hip pain that has been diagnosed or hip arthritis. So perhaps they're coming in for assessment for a total hip replacement. And that's a good example of a type of problem where often the dogs present with quite subtle signs. And, being a bit irritable with their owner or being a bit irritable with the other pets in the house or suddenly with, or not necessarily suddenly, but it can be quite insidious with dogs at daycare, for example, is a really common presentation for hip pain because
Oh.
not specifically just hip pain, but with that particular disease, we'll often see the signs can begin quite subtly, and that can be one of the things that can point us towards there being pain. So a change in behavior with other dogs. Well, you can imagine yourself if you had a really sore, hip and someone was coming and noising you up, you probably wouldn't be very happy about it. So
Exactly. So would you say like hip issues is one of the most common conditions that you see most in like small dogs, or is there
sure.
anything else that you feel is very common? And is there anything that we as like their pet parents actually can look out for before it becomes a big issue?
Yeah, that's a really good point. So, what are the common orthopedic diseases that we see? So, I guess when we think about orthopedics, there's trauma, which is one thing. So, very sadly, we see lots of dogs who can develop broken legs. Maybe they've had a car accident. But putting that aside, thinking about actual diseases, developmental diseases, the most common things that we would see developmental wise in this country, UAE, would be things like luxating patella. So that is where the kneecap dislocates. Now, there's different grades of dislocating kneecap. And I've just remembered that your dog is affected by dislocating kneecap.
Yeah, grade 3 she had.
Oh, bless her. Yeah, so there's different grades and different severities. And the grades don't necessarily correlate with how severely the pet that has the condition is affected. But basically, their kneecap can slip in and out the groove, or they can slip onto the ridge of the groove. So dogs have got a groove that their kneecap sits in. So on the front of their knee, if you think about your own leg, you've got the quadriceps muscle, which is the big beefy muscle on the front of your leg. And then you've got the kneecap, which sits just at the bottom of that. And then your quadriceps muscle with the kneecap within the tendon then inserts onto the front of the shin bone or tibia. And so,
Wow.
what can happen in some dogs is that they can develop a very shallow groove. And so, the groove can be not very good at keeping the kneecap in. And they can also develop, without going into too much detail, but they can develop deformities of the leg, where instead of having a nice straight leg, their leg can be curved and it can cause the kneecap to slip one or other way, most commonly to the inside for small dogs. And that's called medial patella luxation.
Wow.
That in itself can result in most commonly a skipping gait. So you might see that from time to time your dog hops. Now, in some dogs, their kneecap popping in and out very intermittently and it not happening very often at all isn't a big deal. But if that's consistently happening, then what can happen is the cartilage, so the smooth surface on the back of the kneecap, which should be contacting a smooth surface in the groove, can start to erode and you can get what's like an ulcer on the back of the kneecap. And then over
Wow.
time, that can result in premature wear and tear in the joint and arthritis. So when that condition is picked up early, you're less likely to see severe arthritis developing because of this constant popping in and out and rubbing of the back of the kneecap.
Yeah, because I mean, with Piper, so she was literally running in the park, and like I almost feel that it's kind of my fault because I should have stopped her. She was like having such a lovely play and run, and then the next moment, she and this other French bulldog, which was her best mate in Perth, she was just running, 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 and I could see it just snap out.
Yeah.
And yeah, and then, she was kind of limping. And then, like,
Bless
almost, a couple of minutes after she was trying to like walk normal. And I was like, no, this is not good. Like, popped her in the stroller and I ran to the vet and I was like, what is going on?
Yeah.
So, yeah, and then, she actually had to get surgery. But then I was also
Bless her.
like, did she had this before that I didn't pick it up, or was it just that one snap moment and it snapped out? So there was a lot of questions that I had. So, yeah, needless to say, we obviously did surgery, but I didn't know we had to do like physio or things like that afterwards, which I think would have been beneficial for Piper because now it's like one of her like that exact like the back hind, which is giving a little bit of issues at the moment.
Gosh, um, it's one of these things where, so it's really interesting what you describe because we can see a few different types of kneecap problem in dogs. So the most common one that we see in cats is developmental patella luxation or dislocating kneecap, but you can also see traumatic kneecap dislocation. And it sounds a bit from your description, like in this case, if she had no pre-existing hopping, skipping that you'd ever seen,
Mm,
and then she had this traumatic event where she was having the best time of her life. And I would say to you that, it's important that you recognize that it's important that we let our dogs be dogs. And I think as owners, it's really, really common that we'll think, oh my God, this has happened and it's my fault. And if I'd stopped them doing this or I'd stopped them doing that, but they, at the end of the day, they have to be dogs and enjoy their life and have freedom. And
yeah.
just like sometimes, when we're doing things that we enjoy, like playing football, playing hockey, whatever it is, sometimes we'll get injured. The same things can happen to dogs, and owners shouldn't feel guilty about that. We
Yeah.
were talking about how there's different types of patella luxation or dislocating kneecap. And so you can have the developmental type and you can have the traumatic type. I do wonder whether or not your dog Piper perhaps had a traumatic kneecap luxation. There are, of course, some dogs who'll be more prone to having a traumatic kneecap luxation because of the fact that their conformation or the shape of them, they might have a little bit of a shallow groove or a little bit of a curve within their leg might predispose them to having a dislocation of their knee.
Wow, that's very interesting. One of our Pipers Founders Pack members asked, whether running on tiles can actually cause that joint trauma or a luxating patella.
Oh, that's a really good question. So, as far as I'm aware, there are no scientific studies that suggest that running on tiles could cause luxating patella. However, I would say there is a study looking at the development of hip dysplasia. So, hip dysplasia, just to explain what that is for your listeners. So, that is where the dog's joint or the cat's joint doesn't develop. So, the hip should be a ball and socket joint. And so it should move without the hip coming out of the socket. It should sit solidly in it. Now, in some pets, what can develop is lack of fit of that joint. So perhaps the socket is a bit more like a saucer than it's a socket, and the ball is not a perfect circle. You might also have components of laxity or looseness of the surrounding musculature in the capsule, for example, or the little ligament at the top of the ball. All those things contribute to the hip perhaps not being as tight and fitting as well as it should. So that's hip dysplasia. Then over time, dogs with hip dysplasia can develop premature arthritis, wear and tear in the joint, because instead of doing this, their hip is doing this all the time. So that I'm
Oh,
just demonstrating a hip subluxating in and out of the joint. And so there's a study that suggested that raising puppies on slippery flooring could potentially be factor in the development of hip dysplasia. So that's
oh,
something that's really incredibly common in modern houses is that there is usually poor traction flooring, especially in this country. So one of the things that I try and do is have rugs and runner rugs so that there is a pathway that the pet can take which has good traction.
yeah.
And certainly you will often find that if you give the pet a pathway with good traction, they will choose that pathway. And does it per se cause a kneecap dislocating problem? It's not been shown to cause kneecap dislocating, but what I would say is slips and trips, they can cause a marked hyperextension of the knee. And the groove is most shallow at the very top and the very bottom. So those are the times at which the kneecap is more likely to pop out. So if your leg is in full extension, then your kneecap is most likely to pop out, or if it's in full flexion, because those, if you think about the groove, is
Oh.
deepest right in the middle.
Yeah. Oh, wow. And I mean, we often hear people say, listen, let's just wait and see what happens. And, like a lot of the general vets, that's kind of what they would say when a dog starts limping or moving differently. When does waiting actually become a problem? And when do we need to act?
Yeah, it's a really good question. And I think it's really important to balance your approach. Okay. So if every time our pet had a limp on their leg, we took them to the vet and they had a CT scan and an MRI scan, then there would be thousands of dogs and cats having unnecessarily anesthetics and scans. However, key indicators that something isn't right would be if there was a persistent limp that lasted for more than a week. If you had a limp that kept returning on the same leg, then that would be signs that you should definitely see your vet. In the first instance, if your dog was to show lameness or a limp or reluctance to exercise, just like us, the first thing to do is rest them. So rest them for the rest of that day. Don't take them out on their big, vigorous walk. But if the next day they're still not right, I would be taking them to the vet. If things weren't improving or the vet couldn't get to the bottom of what was wrong, then certainly investigations are appropriate. Because, for example, if there is an undiagnosed fracture, so a broken bone, if there is a condition which is not picked up, then down the line it can become harder to treat. So that's
I'm probably one of those dog moms that see our vet more than some of my best friends, but that's
I'm
most
the
probably
same.
because
I'm the same. I've got two dogs, and I think it's really important as a vet to have that perspective as a pet owner. It's so worrying when you see something wrong with your dog because of the fact that you can't communicate with them.
yeah.
So, I've obviously, I've been a vet for 15 years. I was in training for that for 5 years before that. So 2 decades of experience dealing with animals. But as a pet owner who doesn't have, veterinary training can be really worrying because you can't communicate with them. And so there's absolutely nothing wrong with going to your vet to get your pet checked, because if you get them checked and on a physical exam, your vet is happy to wait or do something, then great. But if they recommend investigations, then potentially you can pick up a problem and give them treatment that they need sooner.
Which dog breeds do you see walking through your door most often? And I'm gonna almost like say maybe French bulldogs might be there high on that top list, but yeah, which is it actually?
So I have recently relocated from the UK to the UAE. So I worked in the UK for 15 years as a vet, and we have different populations of dogs in general to the UAE. But when we're thinking about orthopedic disease, there are lots of different patients that we would commonly see. It comes, so common sort of areas would be things like cruciate disease. That is the number one most common cause of a hindland lameness in dogs. So back leg
Wow.
limp in dogs, cruciate ligament rupture. It's something that happens really commonly concurrently with patella issues. So the cruciate ligaments, there's two ligaments that sit inside the knee and they form a cross, and they're really important for the stability of the knee in a dog. You might have heard of ACLs in humans. So, a skier or a footballer who hyperextends their knee and snap, their ACL has gone. Okay. In dogs, they have a different form of ACL problem because it's a degenerative disease. So the ligament itself becomes unhealthy, and then over time, the ligament starts to fray. So I describe it to owners like it's a rope fraying. So it can be more insidious or chronic in onset, or it can be something that presents acutely. And that's a really common thing that we see in dogs, and it can cause, hind leg lameness, something that could happen to any dog. So, but there are certainly dogs that I'll see more commonly. So things like dogs like Labradors, we see cats. Often, unfortunately, overweight cats are particularly prone. We will see French bulldogs, often in combination with a kneecap problem. And then we can see other types of breeds for other specific things. So things like elbow disease, we'll see commonly in Bernese mountain dogs, not many of them in Dubai. Intervertebral disc disease, Dachshunds, French bulldogs. So there are a lot of different types of orthopedic disease that we can see in different types of dog. Now, I've got two spaniels, and spaniels have got a specific elbow condition that they can get, but there aren't a lot of spaniels in Dubai that I've seen so far.
Oh, and another question from our Pipers Founders Pack members, which actually ask, whether neutering, like especially Pomeranians, like around 7 to 8 months, does that have a negative effect on their body development? Like, are there some breeds or some dogs, like, where you say, no, you'll only do that at a certain age because it has an effect on their development?
thinking about the age of neutering. And there are more and more studies looking at that and how it might affect disease that they can develop, not just orthopedic disease, but disease in general. When we look at neutering, there's two different things. So one really common effect of neutering is that the calorie requirement can decrease. So basically, if we think about this, there's a similar thing, for example, in women when they go through the menopause, for example, you would find that women would become more prone to putting on weight after the menopause. And we think about if you neuter a dog, it can have the same effect because it's altering the hormones.
Mm.
So it is because the calorie requirement is reduced. So a common sequelae of neutering is the pets putting on weight or becoming obese if the diet isn't altered. Now, if you alter the
Oh.
diet, then great. They're not going to become overweight. They're not going to become obese. So when we look at what can happen after neutering, it's separating out what is because a pet has become obese and what is because of the neutering.
I definitely feel also there's so like like conceptions, and people don't really understand at what age do they need to get their particular dog. And I also feel, there isn't like according to my studies, and I'm not a vet, like it says that you also need to take into account obviously the breed, actual dog, because if you've got a dog that's very shy and now all of the sudden getting this dog like castrated, it might be an issue because he hasn't developed some social skills, or there might be something, and then he even becomes more shy. And so I think there's so much, but when it comes
And
to like the actual physical like development with the bones, because I think with Great Danes and things, I know they have to be fully grown, so nothing under like 18 months or so yeah,
yes,
so that's kind of, is there anything you want to add?
yeah, it's very specific to the breed of dog. And you touched on there how different dogs reach skeletal maturity at different ages. So typically, small dogs will reach skeletal maturity at a much younger age than, for example, a Great Dane, a Bernese Mountain Dog. In terms of neutering, it's always weighing up. First of all, well, what's the reason for neutering? So if we take a female dog, we may be neutering for health reasons. So for example, to reduce the chance of them developing mammary cancer, it's been shown to have a huge impact. Neutering dogs has a huge protective impact on the development of mammary cancer in dogs. And the younger you do it, the more protective it is. However, there are other things that we balance that up against. So for example, in golden retrievers, it's been shown that it's beneficial to, in two studies now, it's beneficial to leave it slightly later to neuter them to try and reduce the chance of other disease, for example, certain types of cancer. So it's very breed specific. And my
Mm.
advice would be speak to your vet, because your vet has looked at all the specific studies. There are studies that go through all the different breeds and give specific recommendations for age of neutering to weigh up all those things. And absolutely take into account the personality of your dog. So if you have a dog who is fear aggressive, then as you mentioned, castrating them is not going to help them. Now, the use of the term fear aggressive, some people don't use that term, but there are certain types of behavioral condition where neutering them won't help. But one of the things that can be really interesting is that there are implants that you can use in male dogs that is not a permanent way of neutering them. It's chemical castration. So if you're not sure how neutering might affect your male dog, you could potentially go down the route of chemical castration, because then the effects can be reversed rather than it being a permanent thing.
Yeah, wow, that's so interesting. And when you mentioned like the studies and looking at all the scientific research, you have actually founded Moves, which is a free online journal club for veterinarian orthopedics. What made you actually want to build this? And yeah, like give us a little bit more information about that.
So I'm hugely passionate about orthopedics in small animals, dogs and cats. And obviously, that's the reason why I've gone down the route of becoming a board certified surgeon. And one of the things that I'm really passionate about is getting the best outcomes for our pets by collaboration between veterinary professionals and sharing knowledge and experience. And there is so much amazing research that's done by people out there, whether they're in private practice, but more commonly in universities. But lots of vets don't necessarily have access to that research, maybe physical access, or just it's not made in a form which is accessible to them. And so, what I wanted to do was create this Middle Eastern Orthopedics Veterinary Excellence Society where a group of veterinarians could get together and talk about specific conditions in dogs, look at the latest research, and try and improve the clinical treatment of those conditions within the UAE.
I love that. That's amazing. So we'll definitely link up that in our show notes so people can go and find that as well. And then, Dr. Ellie, I wanted to talk to you about something very specific that most dog owners kind of overthink, or sorry, they never think about that. They definitely don't overthink that. Is feeding posture. So, from an
Oh, yeah.
orthopedic standpoint, what is actually happening in your dog's body when they eat straight from the floor?
Yeah, it's a really interesting area, and obviously an area that you have researched massively in creating your products. And when we think about dogs and cats who have osteoarthritis, for example, so wear and tear within the joints, what we're trying to achieve for them is to make their daily activities more friendly to their joints. And when we think about posture of feeding from the ground, dogs will and cats will naturally have to lean significantly forward, puts a lot of pressure on their thoracic limbs. Their joints are going to be extremely flexed in that posture as well. And often we will recommend elevated feeding in orthopedic conditions where we want to reduce the pressure on their joints, make the food more accessible to them without having to put strain on their joints. Obviously, as you know, elevated feeding has a lot of uses other than just joint pain. But that was one of the things that where I would be recommending a patient to use an elevated feeding bowl would be if they had significant osteoarthritis affecting the thoracic limbs or the neck.
Yeah.
If they had neck pain, if they had intervertebral disc disease.
Well, no, that's amazing. And I think that is definitely something, obviously, one of the first questions that we got asked when we took Piper to the physio is how does our dog eat? Because, I'm trying to find out what is that ratio of especially a French bulldog, because they've got such big heads and mass, it's obviously it weighs a lot. And if you compare that to the rest of their body, is it like a third? Is it like a fourth? I'm trying to figure out how much exactly that is because that's a lot of weight that they have to, get up from every single time they take a bite just from the floor. So, yeah, if
Yeah,
you know of any research studies or we can start a research study.
sure that they could mathematically, I'm sure it'd be possible to mathematically model the weight ratio of head to body. And you're absolutely right. French bulldogs and brachycephalics often have a very wide, large head, quite a human head,
Yeah.
and so, yeah, it is interesting to consider.
Yeah, definitely. And what would you say to a dog parent who thinks, this sounds a little bit over the top? Like, my dog actually always eat from the floor. Why should I change that?
So I think it's very dependent on the pet. So in terms of pets that could benefit from feeding from elevated feeding, I would specifically think about pets with esophageal, so food pipe, motility issues, for example. You mentioned about how your pet, Piper, was affected by an esophageal problem. She had what was it? She had her
The hiatal hernia, but
hiatal
she
hernia.
also had aspiration pneumonia when she was little. So all kind of due to
Yeah.
the food and the way she ate.
A really common one that we would see where dogs can develop food pipe or esophageal dysmotility is a certain group of older dogs. So, older dogs who can also be affected by osteoarthritis commonly, where they can develop a dysmotility of their esophagus at the same time, which just means a difficulty in the food pipe coordinating movement. And so it means that they can be more prone to bringing up fluid or food and developing lung infections that we described as aspiration there. So
Yeah.
that's certainly a population of dogs where feeding them from a height can be beneficial.
Exactly. And like from an orthopedic standpoint, what should a pet parent actually be looking for when choosing how to feed their dog? Like what makes a feeding setup genuinely supportive versus just a bowl that looks nice?
Yeah, that's an interesting question. And I would say for me, if you have an orthopedic condition, that is affecting your joints, or a dog has an orthopedic affecting their joints, what we want to avoid is overloading those joints. So making them take more weight, more of their weight through their thoracic limbs than their pelvic limbs. So there should be a 60-40 split. So if they're having to put 90% of their weight through onto painful joints, that's going to be more difficult for them. And having them in extreme flexion or extreme extension of their joints. So often, um, when we think about natural feeding position, dogs, if they have, for example, an uncomfortable neck, perhaps they're crouching and putting their legs into a more forced flexion, which would be more uncomfortable if you had a degenerative joint disease. It's not something I'm not going to lie. It's not something I've specifically thought about that much before, but I think it's an area that deserves more attention. And so I'm glad that you are looking at how we can make feeding easier for our pets and the products that you've developed. I think it could really help a lot of pets.
Oh, thank you. And is there any specific height or posture that you would recommend? Like how would someone know that this bowl is the correct height for this, or is that dependent on like their issue?
Yeah, it would definitely depend on the pet's issue. So what you would be trying to avoid is, for example, if they had thoracic limb front leg problems, if they were, in order to feed, they were having to put all their weight onto their front legs, and you could see that they were rocking really far forward, then that make it more difficult for them. It will depend on the height of the dog, and we've got everything from Pomeranians all the way through to Great Danes. There's such a range there. So anything that is more ergonomic with their posture, where they're not having to change their natural standing posture, you would think that would be beneficial.
And is there any specific breeds or conditions that you would say, like, yes, elevated feeding, like, isn't just a nice to have, it is actually something that is essential for these dogs?
It's a good question. So I'm an orthopedic specialist. I'm a surgery specialist, orthopedic focus. And, so how to feed dogs is not my specialist area. There are specialist nutritionists that would be able to advise on the exact postures. There aren't any studies that I'm aware of in terms of correlating orthopedic disease to feeding. Yeah, I don't feel that I can comment on that. But what I would say is, if you notice that in order to feed, your pet is having to get into an extreme posture, or your pet seems to have difficulty feeding, so it's taking them a long time to feed, they are no longer willing to feed, then trying an elevated feeding bowl seems like a sensible step.
Awesome. And what is one thing that you wish every dog parent knew before their first orthopedic appointment? The thing that that would actually genuinely change some outcomes?
So I mentioned it before, but a really common thing that I'll hear pet owners say is they've been limping, but they're not in pain. And it breaks my heart when I hear it, because the vast majority of pets that we see that have a limp or a lameness have got pain. They just show pain differently to how people show pain. It is incredibly rare to have a pet crying, for example, or whining because of pain. That is incredibly rare. We do occasionally see neurological type lameness, so coming from the nerves or the spinal cord, where they may cry. But in terms of orthopedic disease, it's those subtle things like withdrawing slightly, changing their behavior with other dogs, maybe not being willing to jump where they were previously very happy to jump. They'll often still exercise, but maybe they'll start lying down or sitting down on their walks, or you'll start to see a more pronounced limp on the way back from their walks. Dogs and cats are not going to refuse, or be very unusual for them to refuse to go on the walk. They want to do it. They're motivated. So the biggest misconception that we get is that they're limping but they're not in pain. And I think a lot of those animals, if they've been presented when they first started limping, then they may have less wear and tear that's developed in the joint by the time they have got assistance for their problem.
Oh, so that wait and see, go to the vet first and,
Go to the vet. Yeah.
yes, definitely. And if a listener is actually listening to this, maybe they've got a senior dog or a dog that's been diagnosed with whether it is arthritis or any joint issues, what would you tell them about the quality of life? Is it actually possible to give them like still a really good life if they have been diagnosed with all of these like issues?
Absolutely. In terms of taking the example of osteoarthritis, there are so many different ways that we can help a pet with osteoarthritis. The first step is being diagnosed, so knowing that your pet has that problem. In terms of things that can really impact them, the number one thing that can impact them, I think, in my opinion, is their body condition. So we have so many pets who are overweight, and that can really impact their joints in multiple ways. So make sure if you're a pet owner, there is freely available online body condition scoring charts. So we like to think, just like in humans, we always think, okay, so my dog's 25 kilos, so that's fine. But it's not about your dog's weight, it's about their body condition, because muscle and fat, for example, are different weights. So you could have, for example, a spaniel who is 16 kilos, but they're very overweight. And you could also have a spaniel who's 16 kilos and they're very underweight. So body condition score is more important. And there are charts online that show you basically how to body condition score your pet. And that could be very protective for them in terms of the long-term health and function of their joints.
Oh, that's great. I will try and link one of those online resources in our show notes as well, so our listeners can go there. Dr. Ellie, thank you so much for being on the podcast. Before we ask where people can find you, I wanted to check, is there anything you felt we left out or anything that you still want people to know?
Well, I just wanted to say thanks so much for having me. And I have a huge amount of respect for you and your story. We had a little chance to chat before we started the podcast about your background and your story. I can tell that you're an incredibly, not only a very committed pet owner, but a very passionate scientist. So it's been great to chat. And I'm very grateful for you inviting me on your podcast.
Oh, you're most welcome. And I'm looking forward to actually showing you our prototype in person and actually get some of your feedback as well.
That would be great.
So, Dr. Ellie, where can our Tails and Tones community find you, the work that you do, and also access to moves?
Yes, of course. So, in terms of pet owners, so I work at Suqeim Veterinary Centre in Suqeim, Dubai. I run a referral orthopedic service there. Orthopedics, study of bones and joints, and that means things like fractures, joint problems like cruciate disease, elbow disease. So, any limp, any difficulty with arthritis, for example. We're launching our joint replacement program at the end of the year. So, total hip replacement, we have arthroscopy. So, that's where I can be found doing those things. Then I have an Instagram page that I've started, which has a little bit of an insight into what we do at the vets. So, it's called Ellie. I can be found on Instagram. I just put a bit on there about my patients and about different diseases. And then moves, I do that on Wednesdays. It's not every Wednesday, but it is. So far, I've just started. So I've come here. We've done 6 weeks so far. There are links to that on my Instagram. I've also started a YouTube under Ellie as well. There's not much on there yet, but I'll
Oh,
keep
wow.
adding to it. So those are the main ways that pet owners can access the sort of content that I'm creating. And Moves is more directed for veterinary professionals, although everyone is welcome. It's very, there's a lot of technical veterinary speak in there.
Yeah. Oh, I love that. That's amazing. Well, thank you so much for being on the podcast. I really appreciate it. And yeah, just thank you for the work that you're doing.
Oh, it's an absolute pleasure. You'll know it yourself. We're animal loving people. So to have the opportunity to work with animals for our job, it's an absolute dream. So it's an absolute pleasure. Thanks for having me.
And that is a wrap on today's episode. And honestly, what a conversation to sit with. If there's one thing I hope you take away from this is that so much of what our dogs experience day to day, the slowing down, the stiffness, the quiet discomfort, doesn't have to be inevitable. It starts with knowing what to look for. And now you do. If this episode actually spoke to you, will you do something for me? Please share it. Send it over to a friend, a family member, anyone in your life who loves their dog and might not have had access to this kind of information before, because that's exactly why we make this show, so that every dog parent, wherever they are, can actually elevate life with their pets. That is the whole point of Tails and Tones. And if you found value in what Dr. Ellie shared today, I'd be so grateful if you can leave us a review on Podchaser. It only takes 2 minutes and it means the world. It's how more people can find us and more dogs get better care. If you've got any questions, come on over and say hi on Instagram at Tails and Tones, where every tail tells a story and every tone speaks from the heart. See you in the next one.